So in my clinic, I have a specialty called movement disorder, so I see predominantly tremors, including Parkinson's, but not only, Tourette syndrome, dystonia, restless leg syndrome, and other conditions that affect movement. In the inpatient setting, I see all neurology, so that involves a lot of seizures, multiple sclerosis, a condition called myasthenia gravis. We treat migraines, dementia, confusion, encephalopathy, conditions that affect the brain and the nervous system. Lots of strokes. So usually I ask them how they've been doing since the last time, and I give them an opportunity to bring their questions to the front right away. And then I'll ask them about a lot of targeted specific symptoms that are relevant to the condition I'm seeing them for. So if they have Parkinson's, I would be asking them about their walking, their falls, their tremors, their mood, their swallowing, because some people have dysphagia, which is swallow trouble. I'll ask them about their medicines and whether they're controlling their symptoms adequately or whether they are wearing off or not doing enough. I'll ask them about their general health and if anything has changed. We'll review medications, and then I'll examine them, and then we'll talk about what needs to be adjusted. So my collaboration with other specialties is just critical and consistent and daily. So in my clinic setting, I collaborate a lot with psychiatry because most neurological conditions have the capacity to bring along with them anxiety, depression, some of them obsessive compulsive symptoms, and other things. So psychiatry is critically important. Neurosurgery, because some of our conditions have surgical options like epilepsy, Parkinson's, tremors. We collaborate a lot with neuropsychology to do detailed memory testing. We collaborate constantly with physical therapy, occupational therapy, speech therapy to help offer strategies that increase the safety of our patients or help them improve their symptoms. Those are probably the most frequent. And then in the hospital, of course, with just general medicine, internal medicine, and family medicine specialties. So a psychiatrist specializes in behavioral manifestations of brain disease. So they specialize, they're both neurologists and psychiatrists, and even neurosurgeons are all brain doctors. So surgeons do things that are hands-on and operative, interventions of the brain and the spinal cord, whereas neurologists and psychiatrists are more focused on pharmacological management and behavioral therapy. So psychiatrists manage conditions like depression, anxiety, obsessive compulsive disorder, schizophrenia. So those are all diseases of the brain, but they have manifestations that relate to mood and behavior, whereas neurologists focus on conditions that are more predominantly related to organic, structural, or other changes in the brain. Some people would say that psychiatrists and neurologists similarly manage organic brain disease because psychiatry, all the diseases in psychiatry are also organic, meaning they are related to neurotransmitter deficits or changes in pathways of neurotransmitters. So it's similar. It's more what the symptoms are like and what the patients they would be working with would feel like. So neurologists manage things that can cause, like we talked about, seizures, headaches, tremors, strokes, loss of function of part of the body. And so the conditions are different and are more medical management, more measurable differences. So in neurology, there are things we can assess with images, MRIs or CT scans, and with electrophysiological tests like EEG that looks at the brain waves and the patterns of the firing, or EMG that can look for nerve and muscle disease. Where psychiatrists are mostly talking to explore the conditions in their patients. So neurologists can have, both specialties can have inpatient and outpatient.